Hello everyone, I would like to talk to you today about the different implant types. It can be very confusing to manage the vast array of implants that we have available for breast augmentation. This is a decision that we make together because I really want to know exactly what you're looking for. If you're looking for a more natural result, then I'm going to guide you into an implant that has a little softer gel. If you're looking for a more dramatic change that demonstrates the implant in the upper part of the breast, then I'm going to be more inclined to go with a higher profile implant with a firmer gel. So I'm just going to go through a few of these and help you understand how to navigate the different types of implants. The first decision, of course, is are we going to go with a saline implant? And you can see this has the fill tube attached. We fill the implant up in the operating room, and then we take the tube out. It's very simple. It just comes out just like that. The saline is the simplest of all implants. It's a silicone shell with salt water, which is innocuous to the body. So if it leaks, the fluid is absorbed by your body and excreted through the kidneys, and it does no harm. And then it can be exchanged for a new implant. In probably 5 to 10% of patients within 10 to 15 years, there's going to be a leak of an implant. So it's not an emergency, but it's something that we have learned to take care of and expedite that care. The disadvantage with saline is that it ripples a little more than the silicone implant. So in a thin person, for instance, someone who doesn't have a lot of breast tissue and or fatty tissue to camouflage the implant, it's probably not the best choice because it is more likely to be palpable and more likely to be visible along the skin edge. So I would say maybe 20% of patients select a saline implant, 80% select silicone, but it can be a nice alternative in certain circumstances. One circumstance that is a useful one for a saline implant is a woman who wants a breast lift, doesn't really want a large implant, but wants a little fullness at the top, has enough tissue to camouflage a saline implant, and we're doing a breast lift at the same time. I think a small implant in someone like that works extremely well, and at times it's even difficult for me to detect the difference between saline and silicone, given that circumstance. So I'm going to put that one aside. Silicone has various profiles as well. We can go with a medium profile implant like this, and you can see the width of the implant, comparing it to an implant of approximately the same size. The medium profile is a little wider than the implant that is higher profile. Now, how is that an advantage or disadvantage? With a higher profile implant is going to give more fullness at the top. The medium profile implant is going to give you a more natural effect where it's sometimes hard to tell that you've had an augmentation. And there's even an extra high profile implant. You can see here the profile of this implant compared to the profile of the medium implant versus the profile of the high profile implant. So this is a high profile implant, this is an extra high profile implant, and then this is a medium profile implant. So when is this indicated? This extra high profile implant would be a woman who comes in and there are women who want this. So when is an extra high profile implant used? A woman who really wants dramatic upper pole fullness and demarcation of the implant so that you can actually tell that there's an implant there. That would be the person who is interested in the extra high profile implant. The high profile implant is a very useful implant for a woman who wants an implant above 400 cc's because they frankly just get too wide for most women in a medium profile. So natural result with a medium profile implant, a little less natural, but some upper pole fullness in the high profile implant. Definitely would want to use the higher profile implant when we're above about 400 cc's implant size. One manufacturer has different types of gel with the implants, and The softest of all is the responsive gel. It's very easy to squeeze. It feels very natural. It's the most natural of the implant line at Allergan. There's something called Soft Touch, which is a medium type gel. It's a little firmer, and you can see I can't squeeze it quite as easily as this one. I'm using the same pressure. It's very useful for a balance between the three gels, the third being cohesive. The Soft Touch is soft, yet it ripples reasonably uncommon rippling with the Soft Touch. The cohesive, which has a little more tension when you squeeze the implant, has the least rippling of their line of implants. Responsive gel, Soft Touch, and cohesive. And it's a little firmer, it's a little more visible to the eye, and a little firmer to touch. And then finally, an implant that's relatively new to us in the United States, but used in Europe and South America for over a decade, is the Motiva. The Motiva is turning out to be a really nice implant, has a very nice gel. It also has a soft gel and a firmer gel, the round being the firmer gel, the ergonomic being the softer gel. What's the advantage with the Motiva implant is that the capsular contracture rate appears to be very low, according to the data that we see in the literature from Europe and South America. And so we're excited about being able to use this implant in the United States. And more women are selecting this implant as we go forward. It's a very good implant. Again, it has a low profile, a medium profile, and a high profile, just like the others. And it has a soft gel and a firm gel, for lack of a better word. And so this is sort of a gamut of the implants that we have. There are many more. I hope it's helpful to hear about the different implants and helpful for you to navigate between one and another. And I can give you a whole lot more information when I see you in person and I understand what your goals are for this. So thank you. If you have more questions, just feel free to contact us and we'll get them answered. Thank you.